You are watching the DocTalk show.
So preeclampsia is a condition of high blood pressure. This condition of high blood pressure occurs only in the state of pregnancy. That means it's only pregnant women who will suffer from this condition called preeclampsia. Sadly, preeclampsia causes lots of death in both women and possibly their unborn children. So that's why it's very important for us to learn more about this condition of high blood pressure and how best we can identify and treat it so that we can minimize the complications that arise due to this condition of very high blood pressure. So to start off this discussion again, are there certain factors that would make you say that you're going to get an abnormal placenta, like what they call predictors, like if you belong to this maybe age group, you're at risk of getting preeclampsia? Do those factors exist for preeclampsia?
So we spoke about preeclampsia occurring because of problems with the placenta developing and also problems with the mother's blood vessels. And it could be any combination of those two things. So typically, people who get a problem with the placenta developing, it might be their first pregnancy. And the reason is this: when a woman first becomes pregnant, she's not used to the cells in the placenta in her body. And so her body might reject those cells and it stops the placenta developing properly. Now, when she has other pregnancies down the line, her body's already got used to that process. And so actually, it being your first pregnancy is a risk factor for the placenta not developing properly. Now, other women get preeclampsia more because their blood vessels are not quite so good. Those women typically are older and they may have problems with their blood vessels already because they have hypertension, because they have diabetes, or perhaps they're a bit older than someone having their first pregnancy. They might be 35 or even 40 years old. So their blood vessels are not quite as good as absorbing the high blood pressure.
Okay. Dr. Mugisha, it seems there are very many factors that would cause preeclampsia. I know people may not understand it, so they might have questions. Do you think witchcraft, people there's some beliefs around it? Can witchcraft result in preeclampsia? What are some of the myths you've heard about the causes of preeclampsia?
So in our population here, yes, it's true. People still believe in herbal medications and religious interventions to try and manage it, and probably want to attribute other superstitious causes of preeclampsia, especially when they are in the adversities of convulsions. It can be a bit scary to the community, and they are inclined to thinking, this is small gods or witchcraft, as they're trying to put it, as a causal factor. But research has really put it out there that we know the cause is really placental origin, as Jack said, and all abnormalities in the vessel. We really have no inclination to believe that witchcraft has any role in causation of this abnormality.
So witchcraft does not cause preeclampsia. It is a problem of an abnormal placenta during the event of the pregnancy, and sadly can result in death of the mother and death of the child. So it's a very common condition in Uganda. It causes lots of death. It's the second most common cause of death amongst pregnant women. How can a pregnant woman know that she has preeclampsia?
So majority of women might not know. It's a condition that is largely asymptomatic, or women might not necessarily get any symptoms, and we get to pick it up when we are doing our routine antenatal cares, and it's a coincidental identification of a raised blood pressure.
So it's a quiet disease, in other words?
Yes, like many other non-communicable diseases anyway. It is one of those diseases you might just pick up without symptoms.
A very quiet disease, yet a very deadly disease. So that's why I think you brought up the point that you pick it up incidentally when doing antenatal.
Many of our patients.
Many of the times you pick them up.
Yes.
So I think that's why it's important for people, all pregnant ladies, to always go for antenatal checks so that they can eventually
can have a timely identification and early detection of it setting in.
Okay.
And on that point, Darius, it's not only important that women go to antenatal clinic, but when they go there, they get the right services as well. So some years ago, the World Health Organization said that women should get at least 4 antenatal checks. But then when we looked what was happening in the antenatal clinics, although women were going, they weren't having some of the basic checks like the blood pressure being checked, and they weren't being actively asked for their symptoms. So while going to antenatal clinic is important, it's just as important that when you go there, you get the right service. And so we have to work hard as health professionals to make sure that happens. But we all know that antenatal clinics can be very, very busy. And we do see women still that haven't had their blood pressure checked in the antenatal clinic.
Okay.
And so sometimes women might have to advocate as well for themselves that they make sure the blood pressure is checked.
Blood pressure check. So at each antenatal visit, it's important to have your blood pressure checked. In those in whom the disease is not quiet, it's causing symptoms. Which are the common symptoms it causes, Dr. Jack?
So the common symptoms might be a headache. Okay, you might have pain in your tummy, in your abdomen, and you may also have swelling, which occurs in your legs, but can actually go up the body, and you can have swelling which occurs around the face and around the arms as well. Okay. Some women find they have a disturbance in their vision and might see some spots, or just say that they're dizzy or they have funny vision. Now, some of these symptoms can occur in other illnesses as well. And some of the symptoms, like swelling of the legs, can be normal in pregnancy as well. So sometimes the symptoms can be misdiagnosed or put down to another condition. So you might go to the antenatal clinic, complain of a headache, and be treated for malaria because the blood pressure wasn't checked. So a lot of these symptoms are common to many illnesses. So you have to have an index of suspicion. Is this symptom, which can be quite generalized, could this be because of preeclampsia? Okay.
Dr. Mugisha, since preeclampsia, we know it can either be acquired disease, or if it has symptoms, the symptoms are not as specific. It means other diseases can present with the headaches and the pains in the stomach. What would happen if a lady decides to ignore these symptoms? Would there be any problems resulting from the preeclampsia if it's not detected, if it's not managed?
If it's not managed. So we say complications from preeclampsia, and it's a disease that is not going to be treated as long as the pregnancy is ongoing. So it is it's a form. It builds a form of vicious cycle that will tend to affect many organ systems in both the mother and the child. So from the mother's side, there are many complications that could happen. We probably see a stroke, you know, when it affects the brain, and you see a certain part of the mother not functioning. It could also lead to death. We had looked at 1 in 20 women that actually get this condition from Mulago, as we had seen. We don't have the statistics, national statistics. But
when you say 1 in 20, it means of the 20 women who get
the
preeclampsia, one of them might lose their lives.
Yes.
Okay, so it causes...
That was a study within the national referral system. So yeah, it's not so representative. It is probably lower nationwide, but it is a killer condition.
But you know, it also causes about, it's the second most cause of deaths among pregnant women in the whole of Uganda. Mm-hmm. So it's a very big killer, a very big complication to watch out for. Yes. But when you're dealing with a lady who has high blood pressure, there's a high possibility with a very high risk patient. Mm-hmm. Okay, so Dr. Jack, could there be any other complications apart from stroke and the sad bit of going to death?
So for the mother, the complications might be immediate during the pregnancy and around the delivery of the baby, but there could be consequences long term as well.
Okay.
So we talked about the mother losing their life. We talked about the mother having a stroke. Okay. And for those that might not know, having a stroke, in this case, is probably a bleed which happens in the brain, which can leave you disabled or not able to think properly. And then the other a big consequence that we see immediately is failure of the kidneys. This is very common in preeclampsia. And Moses and I have both seen women whose kidneys have completely shut down after they've had preeclampsia. and they've had to go and have dialysis. That's when a machine does the kidneys' work for the body, which is really very expensive. Even with the government subsidy, dialysis is very, very expensive, and most people die within quite a short time of starting dialysis. So women might die later down the line from kidney failure.
Okay.
So when I say that's immediate, I'm talking about the first weeks or months after they've had preeclampsia.
Okay.
There's actually a risk of having problems later in your life as well. So we know that if you've had preeclampsia, you're more likely to have high blood pressure later in life. You're more likely to have heart disease later in life. You're more likely to have a stroke later in life, some decades down the line.
Okay,
And
so
really important to remember, you're much more likely to get preeclampsia in your next pregnancy as well.
we appreciate the severity, the seriousness of this condition, preeclampsia, and why it is very important that we should be aware of it. It only affects pregnant women. It's a condition of very high blood pressure, and the sad bit is it has so many complications to both the mother and to the baby. So what is most important is how we can treat it, which is what we shall discuss when we come back after the break, how exactly we can treat it, and if possible, whether the condition is preventable. So you can send in your questions and comments to the social media platforms on Twitter, on Facebook, and our doctors will respond to each one of them. Remember, you're watching the DocTalk show. Please don't go away.
You are watching the DocTalk show.